COVID-19, or coronavirus disease discovered in 2019, is responsible for a global pandemic. COVID-19 is caused by a virus called SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, because it's genetically similar to the SARS coronavirus, which was responsible for the SARS outbreak in 2002. Now, coronaviruses that circulate among humans are typically benign, and they cause about a quarter of all common cold illnesses. In COVID-19, what happened is that there were coronaviruses initially circulating among bats, which are a natural animal reservoir that seems to have mutated and ultimately started causing disease in humans. The outbreak began in China, but has since spread around the world. As of April 1st, 2020, or roughly 4 months into the outbreak, there have been over 903,826 confirmed cases of COVID-19 and 45,335 deaths, resulting in a fatality rate of approximately 5%. However, current studies suggest that the actual fatality rate is likely to be lower, around 0.7%. The reason for this is that there are a lot of undiagnosed COVID-19 cases, which makes the actual number of cases go way up. Many of these are asymptomatic carriers, according to the CDC. This can be in as high as 25% of the cases. And there are many lessons to be learned from how different countries have responded to the disease. To explore that, let's use an epidemic curve which shows the number of new cases in a country seen each day. The horizontal line represents the capacity of the healthcare system within that country. Healthcare capacity accounts for things like the number of beds and ventilators, as well as the number of healthcare workers and resources like personal protective equipment, or PPE, they have available. Usually, the healthcare system is working near full capacity. So, when a pandemic like COVID-19 breaks out, even a relatively small increase in the number of patients can overwhelm the healthcare system. So, the two strategies to tackle this problem are to flatten the curve and raise the line. Flattening the curve is focused on diminishing the total number of people that get sick, and slows down the rate at which new people get sick, while raising the line helps to actually increase healthcare capacity. Let's take a look at how different countries apply these two strategies, starting with China, the first country to deal with COVID-19. China informed the World Health Organization about COVID-19 on December 31st, 2019. A few weeks later, on January 24th, China aggressively tried to flatten the curve by placing a major lockdown on the Hubei province, and then issued a similar lockdown on other regions within China. Authorities forced residents to stay at home, except for essential activities like going to the pharmacy or getting groceries. Non-essential businesses and schools were shut down, public transportation was shut down, and roads between cities were blocked off. Going even further, some communities enforced a system by which there was only one entrance and exit, and everyone passing through was screened for symptoms of COVID-19. If anyone in the community tested positive, the entire community might be quarantined. In all, this affected 15 cities and about 57 million people. The measures were swiftly enacted and strictly enforced, and 12 days later, on February 5th, the exponential growth broke, and the number of new cases started to fall off. China made efforts to raise the line. They built multiple hospitals dedicated to COVID-19 patients, and flew in doctors and nurses from less affected regions of the country to staff these hospitals, and kept them protected with well-designed PPE that covered them from head to toe. By March, the economy began to return to normal, and China was seeing more cases of COVID-19 from travelers than from their citizens. Now, let's look at South Korea, which took a slightly different, yet equally effective strategy. To flatten the curve, they implemented mass testing that was free, easy, and accessible. They offered drive-through testing stations, where people were tested inside their car. They also had phone booth-like testing areas where the person walks in, gets tested, and walks out. South Korea was performing 15,000 tests per day, and by March 20th, they had tested around 317,000 people out of a population of 51 million, which works out to 1 out of every 162 people. Those who tested positive were either sent to a hospital if their symptoms were severe, or to a quarantine facility if the symptoms were more mild. At the same time, public health workers conducted contact tracing for every case to track down individuals that might have been exposed to the virus. Because South Korea had such a thorough understanding of who did and didn't have COVID-19 and where they had been, the lockdown was effectively done at the level of the sick individual, rather than at the societal level, like in China. Given the forewarning that South Korea had about the disease and the aggressive efforts around case identification, their healthcare system was well prepared for the patients and had the resources to keep healthcare workers safe. Next, let's look at the United States, which has the most cases in the entire world and where the number of cases continues to rise quickly. In terms of testing, based on the March 20th data, the US lags behind with only 135,000 people tested, which works out to 1 out of every 2,424 people, roughly 15 times less than South Korea, despite both countries having their first confirmed case on January 19th, one in the state of Washington and the other in Seoul, Korea. Unfortunately, the US data doesn't include testing done by private companies, but as of late March, testing has been well documented to be woefully inadequate in most parts of the US, requiring days to get a result, or being unavailable altogether. In addition to the absence of widespread testing to identify which individuals need to be isolated, only some United States have mandated a lockdown, and even when it's applied, there's been minimal enforcement. So in sum, without a federal mandate or enforcement of a lockdown, it's been largely a scattered state-by-state effort that has mostly been voluntary. In terms of raising the line, healthcare workers have generally had inadequate PPE, especially N95s, to feel safe, and as a result, hundreds of physicians and nurses have gotten ill or been quarantined. Meanwhile, intensive care units, or ICU beds, have started to run out. Ventilators are expected to be in short supply, and there have been runs on medications like hydroxychloroquine. Unfortunately, in the context of having scarce healthcare resources, we know that mortality rates can be quite high. Now, here's the good news. A complete lockdown, meaning one that's enforced rather than voluntary so that the maximum number of people abide by it, can stop the spread of COVID-19 within a matter of days, even in a country that is seeing exponential growth like the US. To show how this works, let's start with a community that's already seen an exponential growth in COVID-19 cases. Most folks with COVID-19 have mild symptoms, or have just gotten it and haven't begun showing symptoms yet. There are two options at this point. Option 1 is to let things continue with a voluntary social distancing policy where some adhere to it while others continue to throw pool parties, keep businesses open, and invite relatives over for dinner. In that scenario, even with the best of intentions and cleaning precautions, over the next 2 weeks, there's still going to be an exponential growth in cases, causing hospitals to fill up with patients, and many people will die. But now consider option 2. In option 2, there's an enforced lockdown, with absolutely everyone confined to their home. If that were to happen, the virus could spread to household contacts, but after that, the transmission would abruptly end. As these infected people recover, with no access to new hosts, the virus basically has no place to go. And within 2 weeks, the number of new cases starts to fall. Fewer cases means that the healthcare system doesn't get overwhelmed, and the mortality rates fall because everyone who needs care can get it. This approach and timeline is based on real data from Hubei. The bottom line is, voluntary social distancing is only as effective as the number of people who are practicing it. If enough people don't adhere, then the virus can continue to spread, and the pandemic drags out, ultimately resulting in more deaths. Now, in terms of mortality, the data shows that COVID-19 mortality rates differ by group. So, for example, if you split things out by age, you can see from this table that fatality rate is relatively low if you're below 60, with no deaths seen in children 9 and younger. But then it starts to really climb up for the elderly, so they're really the ones at highest risk. Similarly, the fatality rate is higher for folks with hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer, relative to folks without any of these conditions. And of course, the elderly are more likely to have a lot of these conditions, so it's not surprising that they go hand in hand. Now, overall, based on the current data, over 80% of the patients with COVID-19 have a mild infection, and some people don't develop any symptoms at all. For others, they can develop mild symptoms, like fever, cough, and shortness of breath. Other symptoms include fatigue and things like loss of smell and taste. Serious problems include pneumonia. In addition to causing disease, coronaviruses can spread quickly. It's increasingly clear that a lot of the spread is occurring through pre-symptomatic people, folks that are in the incubation period, many of whom are not at high risk themselves. It also spreads from those with symptoms, like when people cough or sneeze and tiny droplets containing the virus are released. These droplets can land on another person's mouth, nose, or eyes, and that allows the virus to enter a new person. Coronaviruses don't usually spread over long distances in the air, but they can get flung from one person to another on tiny droplets of saliva when someone's coughing or sneezing. Recent studies suggest that SARS-CoV-2 airborne droplets can remain infectious for up to 3 hours. In addition, the SARS-CoV-2 virus can also survive on surfaces. It can survive up to 8 hours on latex and aluminum, up to 24 hours on cardboard, up to 3 days on countertops, plastic, and stainless steel, and up to 5 days on wood and glass. So, make sure you clean and sterilize frequently touched surfaces like phones, keyboards, door handles, and toilet seats with alcohol-based cleaning wipes. Once a person is infected, symptoms develop about 5 days later. This is called the incubation period. Now, there's a debate about how much asymptomatic people or pre-symptomatic, folks that are in the incubation period, are spreading the disease, and it may be much more than what was originally thought. Viruses are given a reproductive number, or R0, based on how quickly they spread, and person-to-person transmission has been confirmed both in and outside of China. An R0 of 1 means that an infected person passes it on to one new person. An R0 of 2 means that one person spreads it to 2 people, and so forth. So if the R0 is below 1, the infection peters out. If it's 1, it stays steady. And if it's above 1, then it continues to spread. The current estimate for COVID-19 is an R0 of 2.2. As a point comparison, the R0 of the flu virus is about 1.3. So COVID-19 spreads quite a bit more easily. To confirm the diagnosis, a reverse transcription polymerase chain reaction, or RT-PCR test, can be done, which can detect very small amounts of viral RNA. It's worth mentioning, however, that early in the disease, the RT-PCR can often miss the infection altogether, meaning that it's not very sensitive. So, if severe pulmonary disease is suspected, a chest CT can be done to help detect the presence of a viral pneumonia. Next, newer rapid testing methods for COVID-19 can get the results within minutes. One of these is isothermal amplification, which also checks for viral RNA. The other is rapid serological testing, which checks for the antibodies created by the immune system to fight the virus. Since it's checking for the antibodies made by the body, it can detect previous infections even after the virus is gone. In terms of treatment, individuals with mild symptoms should isolate themselves at home so they can improve with rest and fluids. For those with severe symptoms, treatment is focused on supportive care, such as providing fluids, oxygen, and ventilatory support for really ill people. As a quick recap, after the start of the COVID-19 pandemic, countries around the world have had varying levels of success in containing the disease. This is done by flattening the curve and raising the line. Some countries, like China and South Korea, have decreased the number of new cases, while in the US, the number continues to rise. A mandated lockdown at a federal level to enforce social distancing and mass testing are key components to preventing the spread of the disease, while raising the line can be accomplished by training more frontline healthcare workers, building more hospitals, and providing hospital staff with adequate PPE. Treatments are focused on supportive care, and a number of medications are in clinical trials.